What are the challenges in selecting gene therapy patients? Imagine trying to fix a broken machine, but the parts keep fighting back. That's similar to what happens when choosing patients for gene therapy. The immune system plays a big role here. It can see the delivery tools, often viruses, as threats. Many people already have antibodies against these viruses, especially adeno-associated viruses, which are common carriers in gene therapy. If someone has high levels of these antibodies, the therapy might not work because the immune system neutralizes the virus before it reaches the target cells. To get around this, doctors might need to lower antibody levels with treatments like plasmapheresis, which filters blood to remove antibodies, or use immune-suppressing drugs. But these methods can have side effects, so they are carefully considered. Another challenge is how the immune system reacts to the new gene product. If the patient's body doesn't normally produce the protein due to a genetic issue, the immune system might see the introduced protein as foreign. This can cause the body to attack the therapy, reducing its effectiveness and possibly leading to inflammation or other side effects. The strength of this immune response depends on the patient's genetic background, the presence of inflammation in tissues, and how the therapy is delivered. Patient selection also involves looking at individual genetic profiles and disease details. Some patients might have mutations that produce no natural protein or truncated versions, which can influence how their immune system responds to the therapy. Knowing these details helps doctors predict immune reactions and decide if the patient is a good fit. Clinical trials often set specific criteria based on immune factors like antibody levels and overall immune health. These criteria vary from trial to trial because there are no universal standards yet. Screening patients involves testing for immune markers and assessing their health status. Sometimes, patients with high antibody levels or immune sensitivities are excluded, or they might need immune modulation before starting therapy. Balancing immune considerations with other factors is key. For example, the goal is to target the right cells, minimize side effects, and ensure the patient is healthy enough to handle the treatment. The immune system can block the therapy from working or even attack the therapeutic gene product. That's why immune compatibility is a major factor in choosing who gets gene therapy. In practice, this means patients undergo thorough immune screening and genetic testing before treatment. Some may need immune suppression to safely receive the therapy, while others might be excluded if their immune profile poses too high a risk. The immune system's natural vigilance, while vital for fighting infections, can be a hurdle in gene therapy. Managing this carefully helps improve the chances of success and safety for each patient.